Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. PCI in patients undergoing transcatheter aortic valve implantation. Background. The benefit of percutaneous coronary intervention. PCI, in patients with stable coronary artery disease and severe aortic stenosis, who are undergoing transcatheter aortic valve implantation, TAVI, remains unclear. Results. A total of 455 patients underwent randomization, 227 to the PCI group, and 228 to the conservative treatment group. The median age of the patients was 82 years, interquartile range, 78 to 85, and the median Society of Thoracic Surgeons predicted risk of mortality score, on a scale from 0 to 100%, with higher scores indicating a greater risk of death within 30 days after the procedure, was 3%, interquartile range, 2 to 4. At a median follow-up of 2 years, interquartile range, 1 to 4, a major adverse cardiac event, primary endpoint, had occurred in 60 patients, 26%, in the PCI group, and in 81, 36% in the conservative treatment group. Hazard ratio, 0.71, 95% confidence interval, C, 0.51 to 0.99, P equals 0.04. A bleeding event occurred in 64 patients, 28% in the PCI group and in 45, 20% in the conservative treatment group. Hazard ratio, 1.51, 95% C, 1.03 to 2.22. In the PCI group, 7 patients, 3%, had PCI procedure-related complications. Conclusions. Among patients with coronary artery disease who were undergoing TAVI, PCI was associated with a lower risk of a composite of death from any cause, myocardial infarction, or urgent revascularization at a median follow-up of 2 years than conservative treatment. Insulin Efsitora versus Degludec in type 2 diabetes without previous insulin treatment. Background. Insulin Efsitora alpha, Efsitora, is a new basal insulin designed for once-weekly administration. Data on safety and efficacy have been limited to small, Phase 1 or Phase 2 trials. Results. A total of 928 participants underwent randomization, 466 to the Efsitora group and 462 to the Degludec group. The mean glycated hemoglobin level decreased from 8.21% at baseline to 6.97% at week 52, with Efsitora. Least squares mean change, minus 1.26 percentage points, and from 8.24% to 7.05% with Degludec. Least squares mean change, minus 1.17 percentage points. Estimated treatment difference, minus 0.09 percentage points. 95% confidence interval, C, minus 0.22 to 0.04, findings that showed non-inferiority. Efsitora was non-inferior to Degludec with respect to the change in the glycated hemoglobin level in participants using and not using GLP-1 receptor agonists. The percentage of time that the glucose level was within the target range was 64.3% with Efsitora and 61.2% with Degludec. Estimated treatment difference, 3.1 percentage points, 95% C, 0.1 to 6.1. The rate of combined clinically significant or severe hypoglycemia was 0.58 events per participant year of exposure with Efsitora and 0.45 events per participant year of exposure with Degludec. Estimated rate ratio, 1.30, 95% C, 0.94 to 1.78. No severe hypoglycemia was reported with Efsitora. 6 episodes were reported with Degludec. The incidence of adverse events was similar in the two groups. Conclusions. In adults with type 2 diabetes who had not previously received insulin, Once weekly, Efsitora was non-inferior to once daily Degludec in reducing glycated hemoglobin levels. Bedaquiline monotherapy for multibacillary leprosy. Background. Standard multi-drug therapy for leprosy may be associated with severe side effects, which add to the stigma and discrimination that affect persons with the disease. In addition, the threat posed by drug-resistant leprosy shows the need for alternative drug combinations and shorter, safer regimens of multi-drug therapy. Results. A total of 9 patients were included in the modified intention to treat analysis. The odds of positive M-lepri growth had decreased from 100% in all the patients at baseline to no growth after 4 weeks of bedaquiline monotherapy. After 7 weeks of treatment, all the patients showed improvement in the appearance of skin lesions as compared with baseline. 7 patients had at least one adverse event, all grade 1 or 2, during treatment. Conclusions. In patients with multibacillary leprosy, bedaquiline monotherapy cleared M-lepri by 4 weeks of treatment, and led to improvement in the appearance of skin lesions by 7 weeks. Obecabtagene Autoleucel in adults with B-cell acute lymphoblastic leukemia. Background. Obecabtagene Autoleucel, Obecel, is an autologous 41BB-zeta anti-CD19 chimeric antigen receptor (CAR) T-cell therapy which uses an intermediate affinity CAR to reduce toxic effects and improve persistence. Results. Of the 153 enrolled patients, 127, 83.0%, received at least one infusion of Obecel and were evaluable. In Cohort 2A, 94 patients, median follow-up, 20.3 months, overall remission occurred in 77%, 95% confidence interval, C, 67 to 85, with complete remission in 55%, 95% C, 45 to 66, and complete remission with incomplete hematologic recovery in 21%, 95% C, 14 to 31. The pre-specified null hypotheses of overall remission, less than or equal to 40%, and complete remission, less than or equal to 20%, were rejected. P less than 0.001. In the 127 patients who received at least one Obecel infusion, median follow-up, 21.5 months. The median event-free survival was 11.9 months, 95% C, 8.0 to 22.1. Estimated 6 and 12-month event-free survival was 65.4% and 49.5% respectively. The median overall survival was 15.6 months, 95% C, 12.9 to not evaluable. Estimated 6 and 12-month overall survival was 80.3% and 61.1% respectively. Grade 3 or higher cytokine release syndrome developed in 2.4% of the patients, and grade 3 or higher immune effector cell-associated neurotoxicity syndrome developed in 7.1% of the patients. Conclusions. Obecel resulted in a high incidence of durable response among adults with relapsed or refractory B-cell ALL, with a low incidence of grade 3 or higher immune-related toxic effects. CRISPR-Cas9 gene editing with Nexiguran Ziclumeran for ATTR cardiomyopathy. Background. Transthyretin amyloidosis with cardiomyopathy, ATTR-CM, is a progressive, often fatal disease. Nexiguran Ziclumeran, Nex-Z, is an investigational therapy based on CRISPR-Cas9. Clustered regularly interspaced short palindromic repeats and associated Cas9 endonuclease, targeting the gene encoding transthyretin, TTR. Conclusions. In this phase, one study involving patients with ATTR-CM, treatment with a single dose of Nex-Z, was associated with transient infusion-related reactions and consistent, rapid, and durable reductions in serum TTR levels. Next we will be discussing articles from Journal of American Medical Association. Electronic sepsis screening among patients admitted to hospital wards. A stepped wedge cluster randomized trial. Question. Does electronic sepsis screening based on quick sequential organ failure assessment score, SOFA, compared with no screening, reduced the mortality of patients admitted to hospital wards? Findings in a stepped wedge. Cluster randomized trial at 45 wards clusters in 5 hospitals in Saudi Arabia. 442 patients were in the screening group, and 3,613 in the no screening group. Accounting for period, clustering within wards, hospitals, and COVID-19 status, electronic sepsis screening significantly reduced in-hospital mortality within 90 days, compared with no screening, adjusted relative risk, 0.85. Meaning in hospitalized ward patients, electronic sepsis screening compared with no screening resulted in reduced 90-day in-hospital mortality. Early restrictive versus liberal oxygen for trauma patients. The TRAUMOX-2 randomized clinical trial. Question: does an early 8-hour restrictive oxygen strategy compared with a liberal oxygen strategy in severely injured trauma patients reduce mortality and/or major respiratory complications? Findings among 1,508 randomized adult trauma patients. No difference was found in death and/or major respiratory complications within 30 days among patients in the restrictive oxygen group, compared with those in the liberal oxygen group, 16.1% versus 16.7% respectively, meaning in severely injured trauma patients. An early restrictive oxygen strategy compared with a liberal oxygen strategy initiated in the pre-hospital setting, or on trauma center admission, did not significantly reduce mortality and/or major respiratory complications. Next, we will be discussing articles from Annals of Internal Medicine. Development and evaluation of a comprehensive prediction model for incident coronary heart disease using genetic, social and lifestyle psychological factors, a prospective analysis of the UK Biobank. Background: clinical risk calculators for coronary heart disease, CHD, do not include genetic, social, and lifestyle psychological risk factors. Objective: to improve CHD risk prediction by developing and evaluating a prediction model that incorporated a polygenic risk score, PRS, and a polysocial score, PSS, the latter including social determinants of health and lifestyle psychological factors. Results: in 388,224 participants, age, 55.5, SD, 8.1 years, 42.5% men, 94.9% white. The hazard ratio for 1 SD increase in PSS CHD for incident CHD was 1.43, 95% C, 1.38 to 1.49, P less than 0.001, and for 1 SD increase in PRS CHD was 1.59 C, 1.53 to 1.66, P less than 0.001. Non-white persons had higher PSS CHD than white persons. The effects of PSS CHD and PRS CHD on CHD were independent and additive. Conclusion: a PSS CHD was associated with incident CHD, and its joint modeling with PRS CHD improved the performance of clinical risk calculators. Next, we will be discussing articles from British Medical Journal. Contemporary Menopausal Hormone Therapy and Risk of Cardiovascular Disease, Swedish nationwide register-based emulated target trial. Objective: to assess the effect of contemporary menopausal hormone therapy on the risk of cardiovascular disease according to the route of administration and combination of hormones. Conclusions: use of oral estrogen-progestin therapy was associated with an increased risk of heart disease and venous thromboembolism, whereas the use of tibolone was associated with an increased risk of ischemic heart disease, cerebral infarction, and myocardial infarction but not venous thromboembolism. These findings highlight the diverse effects of different hormone combinations and administration methods on the risk of cardiovascular disease. Next, we will be discussing articles from Lancet. National level and state level prevalence of overweight and obesity among children, adolescents, and adults in the USA, 1990 to 2021, and forecasts up to 2050. Background: over the past several decades, the overweight and obesity epidemic in the USA has resulted in a significant health and economic burden. Understanding current trends and future trajectories at both national and state levels is crucial for assessing the success of existing interventions and informing future health policy changes. We estimated the prevalence of overweight and obesity from 1990 to 2021, with forecasts to 2050 for children and adolescents, aged 5 to 24 years, and adults, aged greater than or equal to 25 years, at the national level. Additionally, we derived state-specific estimates and projections for older adolescents, aged 15 to 24 years, and adults for all 50 states and Washington, D.C. Interpretation. Existing policies have failed to address overweight and obesity. Without major reform, the forecasted trends will be devastating at the individual and population level, and the associated disease burden and economic costs will continue to escalate. Stronger governance is needed to support and implement a multifaceted whole-system approach to disrupt the structural drivers of overweight and obesity at both national and local levels. Although clinical innovations should be leveraged to treat and manage existing obesity equitably, population-level prevention remains central to any intervention strategies, particularly for children and adolescents. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Clinical outcomes and histologic findings of patients with hepatocellular carcinoma, with durable partial response or durable stable disease, after receiving atezolizumab plus bevacizumab. Purpose: durable partial response, PR, and durable stable disease, SD, are often seen in patients with hepatocellular carcinoma, HCC, receiving atezolizumab plus bevacizumab, atezo-bev. This study investigates the outcome of these patients and the histopathology of the residual tumors. Conclusion: durable PR patients from the atezo-bev group showed a favorable outcome, which may be partly explained by the high rate of PCR lesions. Early recognition of PCR lesions may help subsequent treatment decision. Here are the articles from Journal of Hepatology. Low to moderate alcohol consumption is associated with increased fibrosis in individuals with metabolic dysfunction-associated steatotic liver disease. The distinction of MASLD and MET-ALD categories is based on arbitrary thresholds of alcohol intake. Low to moderate alcohol consumption is prevalent among patients with MASLD. Alcohol increases the risk of significant fibrosis in a dose-dependent supraadditive interaction with cardiometabolic risk factors. In those without SLD, moderate alcohol intake can also increase the risk of fibrosis when combined with cardiometabolic risk factors. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Exon skipping-based subtyping of colorectal cancers. Background and context. The consensus molecular subtyping of colorectal tumors has potential diagnostic value in the clinic. However, the clinical translation of the current expression-based classifiers is challenging due to their complexity. New findings. Here, we demonstrate that alternative splicing, that is, a small number of exon skipping events, can be reliably used to classify colorectal cancer subtypes in a manner suitable for clinical application. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Exon skipping-based subtyping of colorectal cancers. Background and context. The consensus molecular subtyping of colorectal tumors has potential diagnostic value in the clinic. However, the clinical translation of the current expression-based classifiers is challenging due to their complexity. New findings. Here, we demonstrate that alternative splicing, that is, a small number of exon skipping events, can be reliably used to classify colorectal cancer subtypes in a manner suitable for clinical application. Clinical research relevance. Our study demonstrates the utility of exon skipping events to classify colorectal cancer consensus molecular subtypes in individual patient samples. The low complexity classifier presented here is sensitive to subtype-specific biological and prognostic characteristics and shows robust performance, thus indicating suitability for clinical applications. Next, we will be discussing articles in the field of rheumatology. Revisiting the link between HLA-DRB1 alleles and autoantibodies in rheumatoid arthritis, association of non-shared epitope alleles 09 and 15 with high levels of anti-citrullonated peptide/protein antibodies. Objective: autoantibodies serve as essential clinical biomarkers and may indicate etiological mechanisms in rheumatic diseases. In light of the increasing knowledge concerning the diversity and biologic implications of anti-citrullonated peptide/protein antibodies, ASPAs, we have re-evaluated the association between the ASPA response and the HLA-DRB1 allelic groups, known to represent a major genetic risk factor for rheumatoid arthritis, RA. Conclusion: these results indicate a new, previously overlooked, role for the HLA locus in the regulation of the levels of ASPA-RA-specific autoantibodies that goes beyond the shared epitope-defined gene variants. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Periprosthetic joint infection in patients with inflammatory arthritis. Optimal tests to differentiate from flares. Objective: diagnosis of periprosthetic joint infection, PJI, in patients with inflammatory arthritis, IA, is challenging, as features of IA flares can mimic infection. We aimed to cross-sectionally determine if the optimal tests to diagnose PJI in osteoarthritis were present in patients with IA flares to occlusions. Although synovial percent PMNs, CRP, and alpha-defensin are sensitive tests for diagnosing PJI, they are less specific and may be positive in IA flares. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Randomized invitation to systematic NT-proBNP and ECG screening in 75-year-olds to detect atrial fibrillation, stroke stop 2. Background: guidelines have suggested screening for atrial fibrillation to enable early treatment and avoid downstream negative clinical events. We aimed to determine whether atrial fibrillation screening potentially enhanced by NT-proBNP, N-terminal pro-B-type natriuretic peptide, would reduce stroke or systemic embolism incidence compared with a control group, and to determine whether it was safe for those with low NT-proBNP concentrations to forfeit prolonged screening. See occlusions. In this population-based screening trial for atrial fibrillation using NT-proBNP for screening enhancement, there was no difference in risk of stroke or systemic embolism for the intervention group compared with controls. Participation was moderate. The use of NT-proBNP for screening enhancement was safe in identifying low-risk participants. Here are the articles from Journals of the American College of Cardiology. Hospitalization of symptomatic patients with heart failure and moderate to severe functional mitral regurgitation treated with MitraClip. Insights from ReShape-HF2. Background: for patients with functional mitral regurgitation, FMR, and symptomatic heart failure, HF, randomized trials of mitral transcatheter edge-to-edge repair, MTR, have produced conflicting results. Objectives: this study sought to assess the impact of MTR on hospitalization rates, and explore the effects of MTR on patients who did or did not have a history of recent HF hospitalizations before undergoing MTR. Conclusions: these results indicate that a broader application of MTR in addition to optimal guideline-directed medical therapy should be considered among patients with symptomatic HF and moderate to severe FMR, particularly in those with a history of a recent hospitalization for HF. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Diabetes Care. Initiation of intermittently scanned continuous glucose monitoring is associated with reduced hospitalization for acute diabetes events and cardiovascular complications in adults with type 1 diabetes. Objective: we assess the impact of intermittently scanned continuous glucose monitoring, ICAMA, compared with blood glucose monitoring, BGM, on rates of hospitalization for metabolic and vascular complications of diabetes and on EBI, 1C levels for adults with type 1 diabetes. See inclusions. This study shows that adults with type 1 diabetes in Sweden who initiate ICM have significantly reduced hospitalization rates for acute diabetes events, kidney disease, and cardiovascular complications, along with improved glucose control, compared with BGM users. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Impact of dyspnea on adults with respiratory symptoms without a defined diagnosis. Background. We investigated dyspnea, its associated risk factors, and its impact on healthcare utilization, quality of life, and work productivity in adults with undiagnosed respiratory symptoms. Research question. What is the impact of dyspnea in adults with undiagnosed respiratory symptoms? Interpretation. Our findings showed that in community-based adults with undiagnosed respiratory symptoms, those identified with PRISM experienced the greatest impact of dyspnea. Dyspnea imposes burdens on the healthcare system and is associated with impaired quality of life and work productivity. Comparison of early and late norepinephrine administration in patients with septic shock. Background. Vasopressor administration at an appropriate time is crucial, but the optimal timing remains controversial. Research question. Does early versus late norepinephrine administration impact the prognosis of septic shock? Interpretation. Overall mortality did not differ significantly between early and late norepinephrine administration for septic shock. However, early norepinephrine administration seemed to reduce pulmonary edema incidence, and mortality improvement was observed in studies without fluid restriction interventions, favoring early norepinephrine use. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Application of the European Respiratory Society/American Thoracic Society spirometry standards and race-neutral equations in the Obecabtagene study. Rationale. For spirometry interpretation, the European Respiratory Society (ERS) and American Thoracic Society (ATS) recommend using Z-scores, and the ATS has recommended using Global Lung Initiative (GLI) global race-neutral reference equations. However, these recommendations have been variably implemented, and the impact has not been widely assessed in clinical or research settings. Objectives. To evaluate the ERS/ATS classification of airflow obstruction severity. Measurements and main results. The lowest agreement between ERS/ATS with ZLI Global and the GOLD classification was observed in individuals with milder disease. 56.9% and 42.5% in GOLD stages 1 and 2, respectively, and race was a major determinant of redistribution. After adjustment for relevant covariates, ZLI Global distinguished all-cause mortality risk between normal spirometry and the first grade of chronic obstructive pulmonary disease, hazard ratio, 1.23, 95% confidence interval, 1.04 to 1.44, p equals 0.014, and showed a linear increase in exacerbation rates with increasing disease severity in comparison with GOLD. Conclusions. The ZLI Global Severity Classification outperformed the GOLD criteria in the discrimination of survival, exacerbations, and imaging characteristics. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Bioimpedance-guided fluid removal in continuous KRT, the venous randomized clinical trial. Key points. This study, the sole randomized trial of its kind, proposes guidelines for fluid balance management in continuous KRT, CKRT, patients using bioimpedance. Despite this, bioimpedance analysis-guided volume management did not influence the proportion of patients achieving estimated euvolemia at 7 days into CKRT. Further investigation is needed to assess whether bioimpedance analysis guidance can facilitate rapid fluid removal in the early phase of CKRT for patients with A.I.O. Here are the articles from Kidney International Reports. Antiphospholipase A2 receptor, 1 antibodies and membranous nephropathy recurrence after kidney transplantation. Introduction. Membranous nephropathy can lead to end-stage kidney disease, for which kidney transplantation is the preferred therapy. However, the disease often relapses, which can impact allograft survival. Results. The prospective cohort showed a 26% cumulative incidence of membranous nephropathy recurrence after a median follow-up of 23.5 months. This was confirmed by a 28% cumulative incidence after a median follow-up of 67 months in the retrospective cohort. A strong association was found between the presence of anti-PLA2R1 antibodies prior to transplantation and the risk of disease recurrence. Risk ratio equals 5.9. 95% confidence interval, C, 2.3 to 15.7, p less than 0.0001. These results were confirmed in the retrospective cohort. Monitoring of anti-PLA2R1 antibodies in the immediate post-transplant period is of limited value. Because recurrence occurred early in the first 6 months, median delay of 3 to 14 months after transplantation despite decreasing antibody levels. TOTS conclusion. The presence of anti-PLA2R1 antibodies prior to transplantation was a strong predictor of recurrence of allograft membranous nephropathy. An individualized immunomonitoring and management strategy for kidney transplant candidates with anti-PLA2R1 associated membranous nephropathy should be considered. Combination therapy with rituximab and low-dose cyclophosphamide and prednisone in membranous nephropathy. Introduction. Standard treatment with cyclophosphamide, CP, or rituximab, RTX, is suboptimal. We adapted and used the low-dose regimen used in vasculitis, RTX 2 × 1000 mg, CP 1.5 mg/kg/d × 8 weeks, and prednisone, IV 2 × 1 gram plus 3 weeks, oral starting at 1 mg/kg. Results. We analyzed 26 patients, 15 males, aged 57 plus or minus 14 years, PLA2 Rab titer 176, 115 to 460, Ru/ml, serum creatinine 128, 102 to 136 mol/L, serum albumin 18. 14 to 21 GL, and urinary protein to creatinine ratio, UPCR 7.1, 5.7 to 10, G/10 millimoles. Within 8 weeks immunological remission, IR, enzyme-linked immunosorbent assay less than 14 Ru/ml, was 88%. Proteinuria remission after initial therapy developed in 21 patients. 7 patients received renewed therapy, which resulted in proteinuria remission in all. IR and CR were associated with baseline PLA2 Rab turtle. 5 of 7 patients in need of additional therapy were identified at 4 weeks after start of therapy by PLA2 Rab half-life, T1/2, greater than 7 days. Serious adverse events occurred in 4 patients. Adverse events were mild. Leukopenia was most frequent. Conclusion. Low-dose triple therapy induced a rapid IR and CR in most patients. Patients with insufficient clinical response were characterized by high baseline PLA2 Rab levels and longer PLA2 Rab T1/2. Assessment of PLA2 Rab levels within 2 to 4 weeks after start of therapy may enable to identify patients who need more intensive therapy.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.